It's been a day of many developments with the Oxford AstraZeneca vaccine being approved in the UK. What does this news mean for us here in India, given that this is a vaccine that is being manufactured by the Serum Institute? It is the front runner for a COVID-19 vaccine in India as well. It is easy to use, administer as well as store. Also, this news is coming at a time when the mutant strain, the rapidly spreading UK variant of the coronavirus, is spreading rapidly in different parts of the world. 20 cases being confirmed here in India as well. Well, Dr. Shahid Jamil continues to be with us. We're also being joined by Dr. Sumit Ray, the head of Department Critical Care Medicine at the Holy Family Hospital. Thank you both very much. Dr. Jamil, if I can begin once again by asking you, let's specifically look at this news, from an India context. You did say earlier that this is good news for India because it will propel the vaccine to be approved here as well. But given the fact that we're worried about this mutant strain spreading so rapidly, what does this news really mean, and how quickly does India need to approve this vaccine for emergency use?
Well, I would say that the Indian regulator will look carefully at the data that's coming in from the trial, and just because a new variant is there which is known to spread fast, is not really going to be the main reason for approving a vaccine. The main reason for approving a vaccine would be its safety and its efficacy. Yes, a vaccine has to be used to stop the pandemic, but right now I don't think it's very important to use this variant strain to really force a vaccine. And I'm sure the Indian regulator will look at all these conditions and then approve what is safe and what is effective for the population.
Right. Dr. Sumit Ray, do you want to, weigh in? It's good news for India that the Oxford AstraZeneca vaccine has been granted emergency use authorization in the UK, isn't it?
I could not agree more with Dr. Jamil, because we should not rush in a vaccine. We should look at the data, and also my feeling is that this data should also be made public, and experts like Dr. Jamil should be looking at the data and see how effective and what are the side effects and the adverse events that have happened. Not use the excuse of a new variant to rush in a vaccine and its safety without checking its safety profile. Having said that, the new variant is, as Dr. Jamil said, more infective, but there is no evidence to prove that it is more dangerous, that it does not cause more severe version of the disease. And probably Dr. Jamil, who's a virologist, would maybe agree with me that usually in the principles of virology, whatever I know of, is that usually those viruses which become more infective after mutation tend to, I won't say that it's necessary for the SARS-CoV virus too, but usually become less dangerous in terms of mortality or the severity of illness. Right. Usually that's the principle.
But Dr. Jamil, isn't the biggest fear at the moment, burdening of the healthcare system? We are seeing it in the UK already. There's been a huge spike in new number of cases, which corresponds to more number of people, entering hospitals. We are seeing the NHS in the UK, for instance, stretched out thin because of this new strain. Do you fear that, if India isn't quick to control the spread of the new strain, we'll see troubled times ahead as well?
Well, first of all, let me say that Dr. Sumit's understanding of virology is very good. And what he said is exactly right. To some extent, viruses that mutate to spread more quickly lose what we call viral fitness or their virulence. But that's an academic discussion. Coming to what India should do, yes, India should be aware that a new variant is spreading.
Right.
But policy makers can make policy, and they should make policy based on evidence. Whereas the rest of us, it's incumbent upon us to do everything possible to limit the spread. Right. And I could not have said it better than what Jeffrey Smith said earlier on your show, that all of us need to be wearing masks, all of us need to be maintaining a distance, and not unnecessarily putting ourselves at risk. Because remember,
Yes.
avoiding infection is not just going to be personal good, it's also going to be social good. So I think we need to, each one of us are responsible for doing this, and we must do that.
Right. Dr. Ray, do you want to weigh in here? The new mutant virus is a cause of concern because it has the potential to, once again overburden the healthcare system. We're already seeing it happen in the UK. Is that something that you fear?
Yes, of course, Rishika, in the sense, as we have seen in other countries too, and in our country in different phases, like a phase in Delhi in October and November, if the healthcare systems, the hospitals and the healthcare systems get overwhelmed with the number of infections, that itself, even without a higher virulence, does cause a higher morbidity and mortality. Because if we are not able to attend to the patients who are getting a more moderate or severe disease, then the outcomes will be worse in spite of the virulence not being high. And I could not agree more with you and Dr. Jameel and Christopher. So it is very important. I mean, the importance of physical distancing, mask wearing, and hand washing doesn't reduce. But also, as you said, policymakers have to keep a watch on this and see to it that the spread does not increase. And wherever there are surges, if there is a need to have isolated, whatever you call it, curfews or a small area lockdowns may be necessary to reduce the spread of the disease and reduce the overwhelming of the healthcare system.
All right. So it's very important advice to all viewers watching this broadcast that you have to maintain social distancing, wear your mask, wash your hands, especially when you know that there is a rapidly spreading strain of the coronavirus. There's good news in terms of the Oxford AstraZeneca vaccine, but we're miles away from still being given the vaccine, at least to the healthy individuals here in India. Thank you both very much for joining us with your point of view.